Okay, so here is the setup for the overhead press. My setup is as such. What I do first is contract the glute so that the toes will turn outward upon contraction. Big breath, exhale, contract the abdominals 60%. After the abdominals are contracted, the glute and the legs could then relax. The toes will still remain slightly outwards unless I force them in. Step under the bar. The bar should be roughly about clavicle height, maybe a smidge higher. Get under the bar. Step up in order to unrack. Now re-squeeze the glute, turning the toes outward. Feet about shoulder width. Once I have feet at shoulder width and the bar is settled about chest high around the clavicle area, I can then begin the press. I don't dip at the knee. This is a strict press. This is not a thruster. After I strict press overhead, I push the head through the hole. So that's why it's called head through. Afterwards, after I'm done, drop the weight back down, re-rack, depending on how many reps are in that set. So one more time. Squeeze the glute, kicking the toes outward. Lower, the glute is now braced. Big inhale, exhale, contract the abdominal muscles. Now the spine is in alignment. I shouldn't have any arch to the spine. I'm in alignment. I can relax the glute so that I can get under the bar, take it off of the rack, which should be a little higher than clavicle height, a little below clavicle height, give or take an inch or so, so that depending on the rack, so that I can get it out of the rack. Then I can proceed to press overhead for however many reps. Put the head through the hole once the bar goes overhead. And when I say put the head through the hole, I'm just reinserting the neck back in alignment with the spine. That doesn't mean I'm dipping my head through and looking at my toes. Doesn't mean that I'm pushing my head through like I'm some sort of vulture. The head is just going through the hole to keep the head in alignment. The head has to come back out of position when bringing the bar back down so as to not hit myself in the top of the head or break my nose on the way down on the bar. Then I can put the bar back into the rack, lower my legs to drop it back into the J-cups, and I'm done. So a view from the side, the spine would be in alignment. The spine would be in alignment, as in my little friend here. The spine would be in alignment because the inhale will cause you to arch. So if you inhale and contract, you're in an arch, which is going to cause pain or shear in the lower spine. If you exhale, so big inhale, exhale and contract, 60% is so that I can still breathe. If I contract 100%, I can't breathe and I'm too tight to actually catch my breath, and I'm going to pass out before I even start the press. Squeeze the glute, inhale, big exhale, contract the abs. The spine is now in perfect alignment, maintaining the head in the appropriate position. The bar will be roughly around this height. Step under the bar, step up to get it off of the J-cups. I take my little step back. I can then press, pushing the head back into alignment with the body, head through. Coming forward just a smidge is okay. It's not going to cause any issues. If the weight is too heavy and I have to dump, I'm going to still just push it forward to drop it onto the pad. That I have a pad for my platform. And then the spine remains in alignment. The toes and the legs are just nice and solid because the core is nice and solid. If your abdominals are weak and you inhale and you arch, you're going to experience that shear. That's where you're going to get your problems from. So just remember, contract the glute, big inhale, exhale, blow out, contract the abdominal muscles under the bar, or as they say, address the bar, pull it out of the J-cups, press overhead, head back into neutral position, so head through. Proceed with your reps, so head comes back, drop it down, press it again. Back, press it again, head goes through, drop out of the way, drop it, and then repeat. Pretty simple.